I'm Lindsay Broaddus, and today I'm going to be doing my central line check off. So I'm going to now move the camera to my workspace. So we're going to lower it. Okay. So this is my patient, and this is my central line. With the previous dressing, this is my central line dressing tray, my clean gloves, and I also have my sterile gloves over here. So first I would assess the central line dressing through the dressing, and I would palpate over the site. And then I already have my equipment gathered. So now I'm going to perform hand hygiene. And then I already have my goggles on, and I'm going to move this line over. I'm going to remove my kit, discard of the wrapper, place my kit down, move my gloves over here. And I'm going to open the kit, and here we have a mask. At this point I would put a mask on me and also my patient, because that is very important to the central line procedure. So I have a mask over here that I'm going to place on my patient, and I'll put this mask on me. Okay. So then now I would put on my clean gloves. And I'm going to remove the dressing, pulling it towards the center. Okay, and then I will ball the dressing up and remove my gloves, glove to glove, and skin to skin. And I would ball those up, and I would discard of those. Okay, and then next I would now assess the wound for any redness, complications, any drainage, which I do not see any here. It looks like a healthy central line. If there was a possibility or I seen any signs of infection, I would now get a culture. And now we're going to finish opening our kit. So we're going to grab the side, maintaining our 1-inch border, and grab this side, still maintaining the 1-inch border, and the end flap. So at this point now I would put on my sterile gloves, which I'm going to move the camera over here so you can see that. I'm going to pull this on to allow some room. Okay, I'm going to pull my gloves down some, go ahead and open them up. I'm going to grab these flaps here, open them, grab my dominant hand, bring it up, go ahead and glove that hand. And then you can put them on and you can adjust them later. So again, bring this flap open. I'm going to put in this. And I now can adjust my gloves. Go. And now I would discard of the paper into the trash, not dropping below my waist. So go ahead and discard that into the trash. And we are going to maneuver back over here to our patient in our dressing. Okay, so now I would arrange my sterile supplies. I'm going to the chlorhexidine, also maintaining my 1-inch border, cotton swab right there, and my Tegaderm can remain in the bin. And we're going to grab our alcohol swab and remove it from the packaging, and put the packaging in the waste, not dropping below our waist to maintain sterility. And we're going to clean at the site, going outward, making sure never to go back over where we've previously went. So we'll go back over, making sure to work outwards. If at any point I used my sterile glove hand to grab the central line, that hand would no longer be sterile, and it could no longer be near my sterile field. So clean outward, and then discard of it, not dropping below the waist. And then next we're going to grab our chlorhexidine, which is right here, making sure to grab around the side. We would pop the wings, and then we would scrub around the site, making sure to use lots of friction, really just cleaning and getting in there. Sure to clean all around the site. Okay, and then next we would dispose of the chlorhexidine, not dropping below our waist, and we would throw it away. Then next we would grab our bio patch, and we would squeeze the sides, making sure not to touch the insides of it. And it is blue to the sky or words up, and you're just going to drop it over the area or the site without touching the patient or the line to contaminate. So you drop it over, and then now we would grab our Tegaderm, and we would not touch the sides or the inside, just the sides of it. So I'm going to grab our Tegaderm, going to open it, and normally we would take this wrapper off as well, but I'm not going to for this video, just to keep it intact for future needs. And we would place it over the site, and we would normally take the sides of our Tegaderm, tear it, place it on the side, not over the clear wrapper, and we would initial it, date it, time it, and place it on the side for future reference. And then now I would remove the patient's mask, remove my mask, I could take off my gloves, and I would put the patient back comfortably. And that concludes my central line checkoff.